All right, today we're jumping into a field of medicine that is, well, unbelievably high stakes anesthesiology. And it's not just about putting you to sleep, it's about managing life itself. And right now, artificial intelligence is starting to completely reshape it from the inside out.
You know the scene, right? We've all seen it in movies, maybe even experienced it for ourselves. That calm voice telling you to count backward from 10. But what's actually going on in that moment? It's the start of an incredibly complex, data-heavy medical procedure that is so much more than just falling asleep.
You see, the role of an anesthesiologist today goes way, way beyond the four walls of the operating room. They're basically your physician for the entire surgical journey, from evaluating you before surgery to managing your pain to critical care and even resuscitation. They're a cornerstone of the entire hospital system.
But this incredibly critical field is facing a perfect storm of challenges right now, and it's being forced to adapt faster than ever. So let's break down exactly what forces are driving this massive change. First up, and this is a big one, our entire world is getting older. The World Health Organization projects that by 2050, almost a quarter of everyone on the planet will be over 60. And an older population? Well, that means patients with much more complex health issues.
And this demographic shift is creating a really challenging new type of patient. Anesthesiologists are now dealing with patients at the extremes of age who often have a bunch of other diseases going on at the same time. Then you throw in skyrocketing obesity rates and the devastating opioid crisis, and you've got a patient population that demands an insane level of precision to treat safely. At the exact same time, the financial pressure is just immense. I mean, look at the United States. Healthcare eats up a staggering 18% of the entire economy. That's more than double the average of other developed countries. And as we all know, spending more money doesn't automatically mean you get better results. And get this, where all this care is happening is also changing. Anesthesia isn't just for the super-controlled, predictable hospital operating room anymore. Now it's being done in outpatient centers, private doctors' offices, and sometimes even in a patient's own home. That shift introduces a whole new world of variables when it comes to safety and quality. So how on earth does a medical specialty deal with an aging, sicker population, soaring costs, and care happening all over the place? Well, the answer is starting to emerge from this massive flood of digital health data, which just so happens to be creating the perfect runway for an AI-powered response. So when we say AI here, what are we really talking about? Let's keep it simple. Think of it as a bunch of super smart technologies that let computers do things that normally take a human brain. Things like learning from experience, solving really tricky problems, and spotting patterns that a person might totally miss. Now, what's really fascinating here is that AI in anesthesia isn't some brand new sci-fi idea. It actually got its start back in the 90s with systems like the drip refuser, which automated infusions of the anesthetic propofol. That evolved into what we call closed-loop systems in the 2000s. And now, today, we've got these incredibly sophisticated machine learning models that can predict risks and help tailor care to you specifically. This whole evolution has basically handed the modern anesthesiologist a powerful new toolkit. So let's dive in and take a look at the specific AI applications that are boosting their skills right now. You can really group these tools into three main buckets, and each one is designed to help with a core function. You have cognitive support systems to help the doctor think, you have pharmacological models to help them dose with incredible precision, and you have tools for mechanical tasks to help them do really complex physical procedures. Okay, let's look at that digital co-pilot first. Systems called AIMS automatically grab and record every single vital sign and drug dose, which cuts down on human error. Then you have something called a Smart Anesthesia Manager, or SAM, which analyzes all that data as it's coming in to warn the doctor about potential problems before they even happen. It's like having this super vigilant assistant who never, ever gets tired. So how does automated drug delivery even work? Well, it's basically a constant, elegant feedback loop. The system monitors the patient's state in real time, often by looking at their brain activity, and it compares that to the perfect level of anesthesia it's trying to achieve. Then, it makes these tiny automatic adjustments to the drug infusion to keep the patient in that perfectly stable state. That kind of precision is just incredibly hard to do by hand. And finally, you've got the mechanical helpers. Robots are now being used for these unbelievably delicate tasks, like guiding a breathing tube perfectly into place or performing a nerve block using ultrasound to see.
They're not replacing the doctor, but they're absolutely enhancing their skill and their precision.
Okay, so with all of this amazing promise, we have to talk about the ghost in the machine. Because putting AI into such a high-stakes environment comes with some very real limitations and some serious ethical questions we absolutely cannot afford to ignore.
It's really a classic balance of promise versus peril. On the one hand, the potential is just enormous. You're talking better patient safety, way more efficiency, and truly personalized care. But on the other side of the coin, the challenges are just as big. Bad data can lead to biased algorithms, tech can always fail, and the legal and financial roadblocks are still very, very real.
And this brings us to a huge, critical question. If an AI system recommends a course of action that leads to a bad outcome, whose fault is it? Is it the programmer who wrote the code, the hospital that bought the system, or is it the doctor who trusted its guidance? Honestly, the law is still trying to catch up to this new reality.
And this is maybe the single most important thing to remember. As one research paper put it so well, the whole point of AI should be to support medical staff, not replace them. That human touch, the empathy, the intuition, the complex judgment of an expert, that is still absolutely essential in healthcare.
So where does all this leave us?
Well, the future isn't about humans versus machines. It's about creating the Augmented Anesthesiologist, a really powerful new kind of collaboration between human and machine.
And by the way, this future is already here. AI is being used to create these hyper-realistic training simulations for new doctors. It's helping analyze huge sets of long-term data to find better ways to treat chronic pain. And there are trials happening right now to explore totally new ways to use AI in anesthesia. When you boil it all down, the goal here is crystal clear. It's not about replacing the expert in the room. It's about augmenting their skills, freeing them up from the routine stuff, and giving them data-driven insights so they can provide the absolute safest care possible.
Which leaves us with one final thought, and it's a pretty personal one. As these technologies get more and more woven into medicine, how would you feel about an AI playing a critical role in your care? It's a question we're all going to have to think about. Thanks for joining us for this explainer.